Hello. Hi everyone. Hello. Yes, hi everyone. Am I audible, guys? Just give me a thumbs up if I'm audible to all of you. Can you all hear me? Okay. I think now we can start. All right. Hello everyone. So welcome back to my channel today. All right. And today we're going to discuss some very important PYQs. Am I audible? Just give me a thumbs up if I'm audible, everyone. Hi Nivedita. All right. Okay. So let us begin, guys. We will be talking about 4 most important MCQs from your PYQs. Okay. We've discussed the 2020 paper. We are discussing the 2019. All right. So we'll be looking at some of the important questions from that today. Okay. So as you all know me, I'm Dr. Neha. I also take PSM on Unacademy platform. So if you want, you can subscribe to you can attend my free lectures on PSM on Unacademy app, absolutely free on every day 9 a.m. in the morning. All right, I give free lectures. Right now we are doing an INI-CT preparation which is going on, and also 12 p.m. we are having this revision roster for all our FMG students, which also INI-CT and NEET PG students must attend. So tomorrow we are going to have the management of rabies, tetanus, diphtheria, ARI, and also the HIV part which was left from the today's class. Okay, so this is the program for tomorrow. So let us begin. And your first question, everybody, which of the following are included in NPCDCS? Okay, am I visible to all of you, right? All right, let us begin. The first question. Hello everyone, good evening. Chalo, mark karo. Which of the following? This is from your 2019 papers. Good. Any more answers anyone wants to give? Is it CVD? Is it diabetes, hypertension, bronchial asthma? Is it CVD, diabetes, bronchial asthma, CVD, diabetes, stroke? Good evening, good evening. Yes, very good. The answer to this is cardiovascular diseases, diabetes and stroke. Now, which is this program? This program is this one. Okay, so since they gave you a question, next time they can give you to identify the logo. तो ये इसका logo है National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke. Is that clear? This is very, very important. The government of India has been implementing National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke since 2010 up to the district level. Again, this is important under the National Health Mission. Okay? Please remember this tagline also of the program, health in our own hands. Okay? What other question can come from NPCDCS? जो cancer component है ना, this control of cancer, this cancer part was not a part of this program since the very beginning. So if they ask you what modification was done later, so the cancer part of the program was added later. ठीक है? So and now the program was initially launched in 2010 to cover 100 plus districts, but now it covers almost all the districts and has also included, make a note of this, COPD and CKD. This is very, very important. CKD क्या होता है? It has also included chronic kidney disease. Am I clear, everybody? ठीक है? Please remember this. The latest additions to the program are COPD and CKD also. Just so that you know how this program runs, it helps to create health promotion, early diagnosis through screening. Very, very important. Which level of prevention is this? Point number 2, guys. Anybody in the comment section batao? Strategies of NPCDCS. What is this level of prevention? Early diagnosis through screening. ये कौन सा है level of prevention? Yes, anybody? Early diagnosis, very good. This is secondary level of prevention. So that also we are adopting. And look at this point 1 under the program. We are also doing both primordial and primary prevention. Okay, I've also taught you which is the most important level of prevention for control of NCDs. Most important level of prevention कौन सा है for control of NCDs? Most important level of prevention for control of NCDs. Anybody? What will be your answer? Let me see. Primary से भी important क्या है मनी? Primary से भी important क्या है? Most important level of prevention for control of NCDs. It is primordial. All right, please remember this. Most important is primordial. I do not want the risk factors also to develop. I cannot let any one of you drink or smoke also. Okay? So the most important level of prevention is primordial in case of NCDs. Plus timely, affordable, accurate diagnosis is a part of it. Access to affordable treatment, rehabilitation, supervision, monitoring and evaluation also are part of this program. Clear? Most important is primordial level of prevention. Just let us go through this image. ये बहुत important image है guys कि हम लोग how are we tackling the problem of NCDs. At the sub-center level, we have health promotion, opportunistic screening, referral. So they always ask you for non-communicable diseases, which is the type of screening which is adopted. So it is opportunistic screening. ठीक है? So this one is it. CHC में we have NCD clinics. All right. District hospitals. We have NCD clinic, cardiac care unit, cancer care facilities start from the district hospitals. Okay. And last but not the least, you have state NCD cell which provide us tertiary level of services. Okay. So क्या question आ सकते हैं NPCDCS से? The logo can come. What all are a part of this program that could come? Opportunistic screening, all those things, primordial level of prevention, all those things. Cancer was added later. जब program 2010 में start हुआ था, cancer was not a part of it. It was added later, and now we have also added COPD and CKD. Plus, it's running at all the levels, ठीक है? But cardiac care unit and cancer care facilities are start from district hospital and onwards. Is that clear, everybody? Okay, this is very, very important. Now, let us go to the next topic for the day. A doctor is teaching an intern about knee reflex demonstration. What type of learning is this? A doctor is teaching an intern about knee reflex demonstration. This also came in your previous years. Is it cognitive, affective, psychomotor? None of the above. Chalo. All right, I am seeing one answer. Anybody else? Anybody else? Very good, guys. जब हम sociology वाला chapter पढ़ते हैं ना, there we also have a topic on this this thing, learning and all that. Okay, so there are three forms of learning. Let us have a look at it. Learning is defined as any relative permanent change of behavior due to learning and practice. Okay, learning is a permanent change in behavior. It's of three types: cognitive, affective and psychomotor. Cognitive क्या होता है? It is the one associated with knowledge. Okay, you're just gaining knowledge. Affective, because of the knowledge, it's trying to change your, it is associated with attitude change. And when the change attitude is transformed into skill, okay, that is psychomotor, learning associated with skills. So if you see the question over here, okay, you can remember it by CAP. Cognitive, knowledge, A for A, affective, attitude, psychomotor, motor responses, therefore it is skills. Is it clear, everyone? Did you understand this question? और ये देखो, doctor is teaching an intern about knee reflex. So what is he teaching? About some skill. The doctor is trying to develop in the person some form of skill. तो ये क्या हो जाएगा? What had you all answered? Very good. This will become psychomotor learning. Clear? Cognitive is knowledge. Okay. Affective क्या है, everyone? Affective is attitude. Okay, and psychomotor is skills. Clear? Can I go to the next question for the day, guys? All right, let us see the next question for the day. Yes, under ICDS, intersectoral coordination is found in. Now, what is this intersectoral coordination? Is it found in NREGA scheme? What is NREGA scheme? National Rural Employment Guarantee Act. This was also asked in your previous years only. Is it found in NHM? Is it found in National Leprosy Eradication Program or NACP? Intersectoral matlab different sectors. It's the health, it's the nutritional sector, it's the environmental sector. A lot of them are acting together. It's a lot of other programs that is there. Very good, guys. The answer to this is NHM. क्यों? Because this is an integrated this thing. NHM क्या है? It's an overall umbrella. Alright, within this we also have communicable diseases. Yes, we also have communicable diseases. Within this we also have non-communicable diseases. Within this we also have RMNCH plus A. तो आप देख रहे हो, there is intersectoral coordination from all the ends. Okay, so many initiatives are put together in this NHM. Therefore, the answer is NHM. Rural Employment Guarantee Act is like a vertical program only concerned with employment. Leprosy eradication only concerned with leprosy. AIDS control program only concerned with AIDS. So they are all vertical programs. But if you talk about NHM, it's something which is a हॉरिजॉन्टल प्रोग्राम. ठीक है, इस एनएचएम के विद इन बहुत सारी चीजें हैं. Is that clear? Okay, thumbs up everyone if you've understood the first 3 PYQs for the day. Very very important. जब एक ही प्रोग्राम फोकस्ड होता है ना, वो वर्टिकल हो जाता है. Alright, NHM takes into a lot of other things as well. There are a number of initiatives which are included in NHM. So some logos for you to revise, guys. National Health Mission, देखो ये वाला logo देख रहे हो. This, how can you remember? This is National Health Mission. A couple with a son, a couple, a family with a son. Sun is like an overall umbrella to all of us. Okay, overall sunshine. वैसे ही National Health Mission is like an overall protection thing on all of us. What is this? Lotus का symbol. This is national. क्या है ये? This is National Leprosy. क्या है? This is National लेप्रेसी इरेडिकेशन प्रोग्राम. ठीक है, तो ये नेशनल लेप्रेसी इरेडिकेशन प्रोग्राम है. व्हाट इज दिस एवरीवन? दिस इज नाको. ऑलराइट, दिस वन इज द वन व्हिच आई गेव यू, नेशनल रूरल एम्प्लॉयमेंट गारंटी एक्ट, where 100 days of employment is being provided, okay, if the person agrees to do unskilled manual work. ठीक है, all right. Let us see the next question. A drug is introduced in the market after which phase of clinical trial? Is it phase 1, 2, 3 or 4? Very very important is clinical trial. Tell me your answers, guys. For FMG, they ask you this question many times. So when do you introduce a drug into the market? Good, guys. So I'll just show you the stages before we come on to discuss about it. This is the phases of clinical trial. ठीक है, ये क्या है? This is the phases of clinical trial. Now here in the phases of clinical trial, phase 1 is when you have to check the safety and toxicity profile of the drugs. You do it on healthy human volunteers. Okay, that is the phase 1. Is there a thing known as phase 0, everyone? Is there a thing known as phase 0? Yes. Phase 0 is also there. Phase 0 किसमें करते हैं? You do them on human volunteers only, healthy human volunteers, and that is what? That is for microdosing. Very good. Microdosing. जैसे अगर किसी ड्रग के साथ बहुत सिवियर साइड इफेक्ट होता है, okay, is it a good thing? Is it ethically correct that a person who was absolutely healthy dies? It's not a good thing, right? So if a drug, when we are testing it, okay, if that leads to death in a person, that's not a good thing. So we started with microdosing. 1/10 of the total dose was given to see what maximum effect of the drug can occur. All right. So phase 0, please remember, is not done in animals. Phase 0 is done in human volunteers only, where we have reduced the dose of the drug. This is microdosing. Is that clear, everybody? Okay. And what is preclinical trial, guys? Preclinical trial किसमें करते हैं? Anybody? Preclinical trials किसमें करते हैं? The number, you know, actually when you talk about the number of people on which it should be done, देखो, when you do your clinical trials, it's very difficult at times to get people also. Okay, because आपने उनको बुलाना है, they might agree, they might not agree to take part. Okay, so as such there is no cutoff that we have to do them on this much number only. ठीक है, Preclinical trials किसमें करते हैं everybody? Are they done on humans or are they done on animals? Preclinical trial, can you tell me guys? Put in the comment section quickly. Preclinical trials होता है animals में, where there is no ethical concern that we have to address to. Clear? Am I audible everyone? Okay. Phase 1 is to check for safety and toxicity profile on healthy human volunteers. Phase 2 is done on patients to check the drug's efficacy, not potency, efficacy. Phase 3 is like an RCT. ठीक है. Phase 3 होता है randomized control trial which is done on patients to compare. It's like a comparison trial with the existing drugs in the market. Okay, it's a proper RCT that we are doing. Phase 4 क्या है? On patients to access long term and rare side effects, also called as post marketing surveillance. So the drug is released in the market after we all did after this phase. Okay, after phase 3 the drug is released in the market. ठीक है, ड्रग मार्केट में रिलीज हो गया. आफ्टर दैट वी विल गो ऑन टू डू पोस्ट मार्केटिंग सर्विलेंस. व्हाट इज द ड्यूरेशन ऑफ पोस्ट मार्केटिंग सर्विलेंस गाइस? कितने दिन पोस्ट मार्केटिंग सर्विलेंस चलनी चाहिए? एक्चुअली इट शुड बी डन, देयर शुड नॉट बी एनी फिक्स्ड नंबर ऑफ इयर्स फॉर इट, बट हम कहते हैं रफली 10 to 15 years एटलीस्ट पोस्ट मार्केटिंग सर्विलेंस शुड गो ऑन. Okay, ideally it should be continued throughout. Okay, but then that cannot happen, so we give it a tagline of like 10 to 15. Yes, ideally there should be no term limit, no time limit. Okay, so if in your option you have this no time limit, that's okay. ठीक है, lifelong होना चाहिए. But if this is not there, go for the maximum years that they have given, because it will become very expensive to keep doing it lifelong. When does the maximum drug failure occurs guys? In which phase? Phase 0, phase 1, phase 2, phase 3 और phase 4. मैक्सिमम ड्रग फेलियर्स कब होता है? फेज 0 में, फेज 1 में, फेज 2 में, फेज 3 में. वेरी गुड. फेज 2 में maximum drug failures occur in phase 2 guys, not 4, not 3, they occur in phase 2. Is that clear? So these are very very important questions. You must know there is a phase 0 for microdosing which is done in healthy human volunteers. Phase 1 to check safety and toxicity profile on healthy human volunteers. Phase 2 on patients to check for efficacy. Phase 3 is a proper RCT. After that the drug is released in market, and phase 4 is post marketing surveillance. ठीक है, and maximum drug failures occurs in phase 2. Clear? So when do we introduce the market में drug? After phase 3. Okay, next one. Minimum number of antenatal visits required. This is again your FMG question. They've asked many times this now in a lot of examinations. So when you have the term antenatal visits, आप क्या mark करोगे? Very good. Minimum number of antenatal visits, that means they are asking about according to WHO, क्योंकि visit is a term which is given by WHO only. So we'll just have a look. Recommended antenatal visits is 13 to 14. Okay, recommended, or this is ideal. Once every month for the first 7 months, फिर twice every month, 8th month onwards 2 visits, and 9th month में once every week. So this is 4 to 5 visits. Minimum ANC visits according to WHO is 4, alright, which is at the time of registration, the first visit. Then 14 to 26 weeks POG, 28 to 34 weeks POG, 36 weeks POG till term. Clear everybody? So this is how we have the minimum antenatal visits also according to the program. But agar this time they give you a word antenatal care contacts, they don't give you the word visit, then please remember it is 8. ठीक है, and if they give you the term number of visits according to essential ops care, essential ops care अगर word use होता है तो कितने हैं ANC visits? Minimum 3, even postnatal visits minimum 3, and this visits the under the essential ops care has to be made by whom everybody? Either the medical officer or the multi-purpose worker female, ठीक है, sorry, or either the multi-purpose worker female. Clear? Is this clear everyone? Don't forget all these things, ठीक है, very very important. फिर तुम्हारे exams में they have also given home based newborn care, होम बेस्ड न्यूबॉर्न केयर में this came in 2020 paper. Home based newborn care में how many visits are made in home delivery, guys, and who is responsible for that? For that आशा worker is responsible. ठीक है, होम डिलीवरी में कितने विजिट? 7. इंस्टीट्यूशनल डिलीवरी में कितने विजिट्स होंगे? इंस्टीट्यूशनल डिलीवरी, एवरीबडी, इंस्टीट्यूशनल डिलीवरी, गुड, इट इज 6. एंड व्हाट अबाउट इन केसेस ऑफ LSCS गाइस, इट इज 5. ठीक है, तो ये कितना हो जाता है? 1, 3, 7, 14, 21, 28 एंड 42. Institutional deliveries में just remove the 1 out of it. 3, 7, 14, 21, 28 and 42. ठीक है, and LSCS में 3 भी हटा दो. 7, 14, 21, 28 and 42. Okay, so these questions can definitely come in your examinations and they are very, very important. So here my answer was 4. Let's go to the next one. A man came for checkup after his father had a cerebrovascular accident due to hypertension. Which type of prevention is this? Is it primordial or specific protection? So this was a 2020 question, but we had not been able to do it. So tell me your answers. A man has come for checkup after his father had a cerebrovascular accident due to hypertension. What type of prevention is this? Again, I'm getting mixed answers. B, D, C, कोई कुछ बोल रहा है. See, whenever you come to get detected for something, why is this person going to go for a checkup? To see whether some disease is starting in him or not. तो ये क्या हो जाएगा? सेकेंडरी. ये क्यों जाएगा हॉस्पिटल पे? ये इसलिए जाएगा क्योंकि रिस्क फैक्टर तो था, बट नाउ ही इज वरीड दैट मे बी इज डेवलपिंग CVA. Okay, so to rule out that, he is going to the hospital. Okay, so I have written it for you. See, primordial level of prevention is before risk factor, primary after, secondary early part of disease. The disease has just started and we want to find that out. Tertiary is late part of the disease. Here the patient has come for checkup means he came to detect the disease early and he has not come for any form of prevention. वो क्यों आया है कि अगर डिजीज शुरू हुआ है then it must be detected in him. He has not come for any form of prevention. Secondary prevention can prevent the disease. It is for cannot prevent the disease. Secondary prevention is only for early diagnosis. If I am able to detect the disease early, it will lead to better prognosis and better survival. Clear everyone? So whenever such a question comes that his father died of CVD, so he wants to find out whether उसको तो CVD नहीं हो रहा है, तो वो चेकअप के लिए जाएगा, तो वो सेकेंडरी हो जाएगा. एनी विच वेज, एनी फॉर्म ऑफ एनुअल हेल्थ चेकअप गाइज, which level of prevention is this? Any form of annual health checkups, whether it's school health, whether it's anything, okay, it is a secondary level of prevention. I want to make an early diagnosis of the disease. Next easy question, this came in your 2019 paper. Mid-year population is taken on, mark this. Did I tick the answer here? Yes. Mid-year population is taken on 1st of September, 1st of April, 1st of November, 1st of July. Good. It is taken on 1st of July. You have to know CBR. CBR क्या होता है? The total number of live births. Okay. The total number of live births per thousand what? Per thousand mid-year population. According to SRS 2020, the current CBR is 20. फिर CDR क्या होता है? CDR होता है आपका total number of deaths. Okay, total number of deaths per thousand live births. Okay, and according to SRS 2020, what is the current CDR? It is 6.2. So please remember, the questions are not very difficult which has come in our FMGs. ठीक है? If you have revised it, you will be able to answer. Similarly, one more information I'll just provide to you. What is the current maternal mortality ratio? That is 113 per 1 lakh live births. And what is your infant mortality rate? वो भी आपको पता होना चाहिए. ठीक है, infant mortality rate currently कितना है guys? 32 per thousand. 32 per thousand what guys? 32 per thousand live births. ठीक है? Okay, next question. Identify the statistical diagram. So they've given this twice in your examinations guys. What is this statistical diagram? बहुत बार उन्होंने examination में दिया है. Can you mark it? What is this statistical diagram everyone? Okay, good. This is a histogram which is used to represent continuous data. All right, तो हमारे FMG में they can give this question again, any of the diagrams they can give. So what does a bar diagram look like? Histogram represents continuous क्वांटिटेटिव डेटा, ठीक है, क्वांटिटेटिव डेटा कंटिन्यूअस रिप्रेजेंट करता है. ये देखो, this one, what is this figure guys? A, B and C. I keep showing you these because there it is very important. कभी ना कभी ये आएगा दोबारा से पेपर में. यहाँ पे देखो, there are gaps and I'm just asking you children, do you like red color, blue color, green color, yellow or pink? So this is what you can either like red or blue, you cannot lie in between. So this is used to represent what? This is used to represent discrete variable. तो ये क्या हो जाएगा? Bar diagram. This is a simple bar diagram. So a simple bar diagram represents what? A simple bar diagram is used to represent qualitative discrete variable. What is this option B? Okay, I have asked squash. When do you play squash, zucchini? Like when do you eat all these things? Maybe day 1, day 2, day 3. So this is a multiple bar diagram. Okay, important. Multiple bar diagram बोलो इसको, या इसको आप क्या बोलोगे? This is also known as a composite bar diagram. And look at this one. This one is in a single bar. It's in different proportions. So this is a component bar diagram. Clear? Okay, so this is how you must remember. Then there was a option of scatter plots in it. So scatter plots is used to represent correlation between what? Correlation between two quantitative variables. Okay, this is used to represent correlation between two quantitative continuous, rather we must say continuous variables. ये क्या है? Positive correlation, negative, and this is no correlation. So the value of correlation coefficient is -1 to 0 to +1. -1 is perfectly negative, 0 is no association, +1 is positive. Okay, and what is this one guys? When we join the midpoints of these, this becomes what is known as a frequency polygon. Can you all see this? ये क्या हो जाता है? Frequency polygon. So it gets closed from all the sides when you join the midpoints. तो ये हो जाता है तुम्हारा frequency polygon. Very good guys. Okay. Next, this question also came in our 2019. Identify the logo. So I'll just revise with you the different logos. ये क्या है? AGMARK, PFA, FSSAI या Bureau of Indian Standards. Good. This is Bureau of Indian Standards. Guys, किस मिनिस्ट्री के अंडर ब्यूरो ऑफ इंडियन स्टैंडर्ड्स कम? दिस कुड बी योर MCQ. सो प्लीज रीड दिस. द ब्यूरो ऑफ इंडियन स्टैंडर्ड्स इज द नेशनल स्टैंडर्ड्स बॉडी ऑफ इंडिया वर्किंग अंडर द एजीज ऑफ मिनिस्ट्री ऑफ कंज्यूमर अफेयर्स, फूड एंड पब्लिक डिस्ट्रीब्यूशन. सिंस दे आस्क्ड यू BIS, दे कैन आस्क यू नेक्स्ट टाइम कि कौन सा मिनिस्ट्री इसको देखता है. ऑलराइट, सो दिस इज Ministry of Consumer Affairs, Food and Public Distribution. All right, Government of India. You don't need to know when it was established, all that. Bureau of Indian Standards is the national standard body of India responsible for harmonious development of activities of standardization, marketing and quality. So basically it certifies the quality of our food products. Is that clear? Certifies quality of food products. ठीक है? So you might be asked, it comes under the aegis of which ministry? So please remember, Ministry of Consumer Affairs and Food and Public Distribution. FSSAI नहीं है. All right, it is Ministry of Consumer Affairs, Food and Public Distribution. ठीक है? FSSAI is the Food Standard Safety Authority of India. I'll just show you this. This is FSSAI, which is the Food Safety and Standards Authority of India, which is under Ministry of National and Family Welfare. Okay, this gives us our national food standards. Okay, our national food standards have been set by FSSAI, which is under Ministry of Food, Health and Family Welfare, and we adopted our national food standards from Codex Alimentarius, जो कि international food standards set करता है, by two organizations, WHO and FAO. WHO has headquarters in Geneva. FAO has headquarters in Rome. Is it clear, everyone? Some other logos that you must know. Look, this is Bureau of Indian Standards. This is AgMark. AgMark इस बार आ सकता है. This is for agricultural products. ISI is, what is ISI, guys? ISI is Indian Standards Institution. Okay, this also certifies the various products, not just food, but also industrial appliances. Okay, and this is um, um, another thing which can come, Indian Standards Institution. So we'll just write over here Indian Standards Institutions. अब ये बताओ FPO क्या है? Anybody? This is Fruit Product Orders. Okay, so this ensures the certification of fruit products. Okay, yes, इसमें लिखा हुआ है AgMark में agricultural. ठीक है. Now look, food product orders जो हम बोलते हैं ना FPO, that is fruit product orders. It certifies कि जो हम canned fruit लेते हैं, fruit juices पीते हैं, वो सही है या नहीं. Then look, this logo can come. This is for organic food products, and there is one movement which has recently started, guys. Eat Right India. Eat Right movement, okay, which tells us about what to eat, what not to eat, kind of thing. This can come in your exams this time. This is an initiative of FSSAI. Clear? Will you remember these things, guys? Eat Right movement is very, very important. So you must know FSSAI का logo, Codex Alimentarius याद रखना. Then you must know the, we'll just go through the logos once again, okay? Yes, BIS, Bureau of Indian Standards, AgMark, Indian Standards Institution देख लो, Fruit Product Order देख लो, all right. Then FSSAI, please remember, Codex Alimentarius का लोगो देख लो, कोई भी एक लोगो आ सकता है. Organic products के लिए and Eat Right movement, last but not the least. Let's have this last question for the day, guys. School health guidelines include all except. So what is your answer? School health guidelines include all. Sorry, I think I framed it the other way. Does not include होगा. एक second. Yes. What are the school health guidelines, everybody? What are the school health guidelines, everyone? Okay, actually question थोड़ा सा opposite I have written by mistake. All right, I'll just tell you one second. Actually ये होना है false statement. Okay, school health guidelines false statement or not true. Now mark it please. School health guidelines false no. School health guidelines true statement. You have to mark it true statement. Which is the true statement now? Guys, please mark it. True statement कौन सा है school health guidelines में? Okay, once again, true statement. Very good. Yes. By mistake, I just wrote it that way. School health guidelines में, which is the true statement, very good. It is minus desk type. Okay, so we'll just quickly revise our school health guidelines. Once classroom, less than 40 students. Okay, it has come many times in your entrance examinations, guys. School health बहुत बार आया है. एक classroom में less than 40 students. Minus desk type. Doors plus windows more than equal to 25% of floor area it must include. One urinal per 60 students. One latrine per 100 students. Natural light from the left side. Why from the left side? Because we are all right-handers. Mostly people are right-handers. इसीलिए light left side से आना चाहिए. Minimum area more than 10 square feet per student should be present. School health examination once every 6 months it is done. Very very important for your revision, guys. School health. अच्छा इसमें एक चीज और बताओ. Which was the first committee that spoke about school health? The first committee to speak about school health. The first committee. सबसे पहला committee क्या था? to speak about school health? Anyone? The first committee to speak about school health that gave us an idea about school health? No, not Srivastava. Very good, Divya. It is board only. Board committee only was the first committee which spoke about school health. But then not Renuka Roy. सबसे पहले board committee ने बात किया था. Then came Renuka Roy. Okay, second was, this was the first committee. Then second, Renuka Roy. Renuka Roy ने क्या बोला? Renuka Roy said that we must have school health examination once every, how many years, guys? Once every, she said 4 years. But what is the current thing that we are doing? Once every 6 months. Okay, so let's go back to this question. देखो, minimum area per student is 5 square feet per student. No. How much it is? You can see here, it is 10 square feet per student. Minimum is 10 square feet per student. Minus desk, yes. Can allot 60 students per classroom? No. How many students can be allotted per classroom, guys? Batao. How many students can be allotted per classroom? एक classroom में आप कितने students allot कर सकते हो? 40. Light should come from front? No. Light should come from left side. Clear, everyone? Okay, so these were some of the questions. One last question that I want to revise with you is a type of study design which they have given in your MCQs. Researcher was conducting study in relation of depression associated with history of social media usage. One group had social media users with depression and another group had social media users without. So what type of study design? Think carefully, guys. Yes, here it is becoming, which type of study design is this? You already have a group of social media users, so you have actually two groups, guys. It's not at all a cohort study. आपके पास दो groups हैं. A group, this is your population. You have one group which is depressed, okay, and the other group which is not depressed, okay. One second. The other group which is not depressed. फिर आप क्या करोगे? You depressed. You are going to go back in time to assess what? You're going to go back in time to assess the exposure status. That how many had an influence of social media over them in this depressed group and how many in this not depressed group. It is case control study design. समझ में आया? Cohort तो है ही नहीं क्योंकि you are starting and they had a history of social media usage. In cross-sectional, I determine exposure and outcome at the same time. So this is a design of a case control study. You start with population cases control. So this group is depressed. Okay, this group is depressed and this group is not depressed. And I am just going to go back in time to assess the social media usage. Clear? What is the measure of strength of association in a case control study design? What is the measure of strength of association in a case control study design? It is odds ratio. Odds ratio more than 1 is equal to positive association. Odds ratio equal to 1 implies no association. Odds ratio less than 1 implies negative or inverse association. Am I clear, everybody? Okay. So did you understand the questions for the day, guys? These were some of the most important PYQs that have come from your exams. Please don't forget the school health wala question. It can again come this time. And from tomorrow onwards, we will be continuing regularly with our FMG series on Unacademy app, guys. I will let you know the timings by today only. ठीक है, FMG series Unacademy app पे चलेगा. And we are also going to have an INI-CT series till 15th continuously on YouTube. YouTube में कल से हम लोग FMG के classes भी करेंगे, ठीक है. Saturday and Sunday will be 11 AM and thereafter every day it will be happening at 4 PM starting from Monday onwards, ठीक है. कल और Sunday को I think only tomorrow we'll have it at 11 AM. Sunday onwards we'll have it at 4 PM, guys, ठीक है, on YouTube Unacademy app. So we will be continuing with our 5 images, 2, 3 numericals and 5 must-know MCQs for FMG series every day for half an hour starting from mostly tomorrow or otherwise from Sunday onwards. Clear, everybody? ठीक है, so you can attend. Meanwhile, कल अन अकेडमी ऐप पे बहुत इंपॉर्टेंट क्लास है सुबह को. It is on 12 p.m. on the management of all rabies, tetanus, diphtheria, ARI and the HIV part which was left. Okay. So don't worry, don't stress out, keep studying, have a very good day. बिल्कुल टेंशन मत लो. Don't waste your time on social media platforms. Just keep revising, keep studying. खुद पे ध्यान दो, अपनी बातें सुनो, ठीक है. डोंट लिसन टू अदर्स. यू आर द बेस्ट जज ऑफ योरसेल्फ. व्हाट यू नीड टू स्टडी नाउ, हाउ मच यू नीड टू स्टडी. डोंट वेस्ट योर टाइम ऑन टेलीग्राम चैनल्स और ऑन एनी अदर सोशल मीडिया प्लेटफॉर्म. जहां से पढ़ा है बेटा बस उसको रिवाइज करो. ओके, एंड यू विल डेफिनेटली सक्सीड. यस, वी विल बी कंटिन्यूइंग till exams from tomorrow. It will be conducted on Unacademy app every day. Okay, till your FMGE exams. I'll be very soon sharing the roster. Okay, yes. High yield session तो चलेगा ही, ठीक है. Shashikant, okay. 9 a.m., 12 p.m. and we might have 4 p.m. and we will have 6:30 classes. Okay, all right. Bye bye guys. Have a very good day. Thank you for attending.